Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73560 Radiologic Examination NE, 1 or 2 views, use code to report 1 or 2 views. 73562 Radiologic Examination NE, 3 views, use this code to report 3 views. 73564 Radiologic Examination NE, complete, 4 or more views. Use this code for a complete knee exam with 4 or more views. These views are used to evaluate the knee joint and adjacent structures. The number and type of views directly affect CPT code selection. Group by clinical focus. Standard views: knee AP view, knee lateral or rolled lateral, knee lateral cross-table view, knee AP oblique view. Weight-bearing and alignment views: knee AP weight-bearing bilateral, knee PA weight-bearing Rosenberg method. Intercondylar tunnel views: knee AP axial intercondylar Beclair, knee PA axial Holmblad, knee PA tunnel Camp Coventry, knee intercondylar. Patella sunrise views: patella PA, patella lateral, patella PA oblique, patella tangential Houston Merchant, Setagast, Lorine methods. Report example: order exam, knee 1 or 2 views. Right. Header, AP and lateral views of the right knee. History, injury, comparison, 10/27/2022. Findings: unchanged alignment of plate and screw, fixated mid-pole patella fracture. No interval hardware complication. Progressive healing, decreased joint effusion. Anterior soft tissue edema, impression, healing internally fixated patellar fracture. Let's look at the views. AP and lateral, that's 2 views. This qualifies for CPT code 73560, Radiologic Examination knee, 1 or 2 views, right? Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state: this is a subsequent encounter for a healing patellar fracture with hardware in place and no complications noted. The most appropriate ICD-10-CM code is S. 82.055D. Non-displaced fracture of right patella, subsequent encounter for closed fracture with routine healing. This code is selected because the report confirms an internally fixated patellar fracture with expected healing, no complications. This aligns with NCCI Radiology coding guidelines, which direct coders to report follow-up imaging using the correct 7th character based on healing status. Correct codes for this report include CPT 73560, right, Radiologic Examination knee, 1 or 2 views, ICD-10 S82.055, D, non-displaced fracture of right patella, subsequent encounter for closed fracture with routine healing. Report example: order exam, knee 3 views left, header, AP lateral and oblique views of the left knee. History, injury, comparison, 8/19/2022. Findings: healed fracture of the distal femoral metaphysis with post-traumatic deformity and heterotopic ossification. Unchanged lateral plate and screw fixation. No evidence of hardware complications. Similar tricompartmental osteoarthritis. No joint effusion. Impression: chronic healed fracture with surgical hardware and osteoarthritic changes. Let's look at the views. AP, lateral, and oblique, that's 3 views. This qualifies for CPT code 73562. Use 73562 to report 3 views. Report findings state: this is a chronic post-traumatic deformity following a healed fracture of the distal femoral metaphysis with stable hardware, heterotopic ossification, and tricompartmental osteoarthritis. The most appropriate ICD-10-CM codes are S 72.491P, other fracture of lower end of left femur, subsequent encounter for fracture with malunion. This code is selected because the radiology report confirms a previously fractured distal femur with post-traumatic deformity. Under ICD-10-CM guidelines for radiology coding, per NCCI, this constitutes a malunion of the femur, requiring the 7th character P. For malunion in a subsequent encounter, it accurately reflects the chronic, healed state with residual deformity. And M17.12 unilateral primary osteoarthritis left knee, supported by the report's statement of tricompartmental osteoarthritis, indicating degenerative joint disease affecting all compartments of the left knee. Correct codes for this report are CPT 73562 left, Radiologic Examination knee, 3 views, S72.491P, other fracture of lower end of left femur, subsequent encounter for fracture with malunion, Chart report, order exam knee 4 views, left header, AP, latch and merchant views of the left knee. History, acute pain, no injury. Comparison, none available. Findings, no acute fracture or dislocation, no joint effusion, minimal degenerative changes. Prior ACL reconstruction. Impression, no acute osseous abnormality, chronic post-surgical state. Let's look at the views. AP, lateral, notch and merchant, that's 4 views. This qualifies for CPT code 73564, left radiologic examination, knee, complete 4 or more views. Report findings state, the patient presents with acute pain and a history of ACL reconstruction, but no acute findings or effusion. The most appropriate ICD-10-CM codes are M25.561, pain in right knee. This code is selected for acute knee pain without trauma or fracture. Z98.890, other specified post-procedural states. This code is used to document prior ACL reconstruction in the absence of a more specific code. Correct codes for this report are CPT 73564, left radiologic examination, knee, complete 4 or more views, ICD-10, M25.561, pain in right knee, and Z9890, other specified post-procedural states. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.